We're also live on YouTube, but I haven't shared the link yet. And your volume is a bit low.
I'm not speaking loud.
Okay, just wanted to let you know.
Gotcha.
Hey, test, test. Sounds okay.
Yep, we can hear you.
Right. Welcome, you guys. We're going live. We can go ahead and start letting folks in, I would say.
Okay, sounds good.
Started a little bit earlier. Hello, everybody. Welcome to our first City Workers. Oops. So there we go. Welcome to our first City Workers Public Health Briefing for the year 2023. I hope everyone had a lovely holiday season and got some rest and relaxation, much needed. My name is Dr. Julian Watkins with the New York City Department of Health and Mental Hygiene. I am currently the acting assistant commissioner for the Bureau of Health Equity Capacity Building within the Center for Health Equity and Community Wellness. We want to welcome everyone who's new to the space and welcome all the folks who may be returning. Just a friendly reminder that this space is set up and created and run with the help of a lot of folks. A lot of the images and data that we're sharing reflects the hard work of a lot of our fellow city workers here at the Department of Health and Mental Hygiene. Dr. Wong and I are medical specialists, public health specialists. We do not specialize in HR and other policy issues, so we can't really speak to any of those, even though we know that there are a lot of HR and policy implications to a lot of things going on in public health. But we want to just open up the space again this year, talk about many of the things that are going on, raise some concerns, answer some questions. We'll give folks a few more minutes to log in. If folks want to share in the chat how they're doing today. Apologies for any noise in the background. If folks want to just share in the chat how they're doing today, or if there's anything that folks are looking forward to for the weekend, we can go ahead and share. We'll give folks a few more minutes. We're going to run like 3 more minutes for folks to log in and get their audios adjusted. But if anyone wants to share in the chat, feel free. Looks like things are slowing up a bit, but we'll give it another minute or two. We're just welcoming folks to the space. Folks are just, catching up in the chat. If folks want to share anything that they're looking forward to, or just any notes of gratitude in the new year, anything that folks want to hearken into the year. Yeah, we have some singing and film watching this weekend. Love that.
Yes, that's.
Amen to that, Catherine. Grateful to be alive. We are still here. Thank you, Ellie. Definitely much appreciation and gratitude for all the hardworking city workers, these heroes who kept up with it and showed up through some of the worst of times and keep the city running. Okay, I think that we're doing pretty good. And folks coming in, so we'll get started. And again, just welcoming into the public health briefing. Start again. Welcome to the first public health briefing for city workers for the year 2023. I want to welcome everyone to the space, those who are just joining, but also for the first time, but then also folks who may have been attending these spaces in the past. Again, my name is Dr. Julian Watkins, serving as the acting assistant commissioner for the Bureau of Health Equity Capacity Building here at the New York City Department of Health. Today's presenters will be myself and Dr. Marsha Wong, MD as well. So we'll hop right into it. I just want to give a little bit of the agenda. We'll definitely be giving an update on COVID-19, really talking about what the current situation is. We'll give an update on the bivalent booster. There's some new information that's come out of the CDC and the FDA in terms of efficacy or how well these vaccines are working. We also do we'll unpack a little bit around this new variant that folks may be hearing that's circulating. So we want to get into what we do know. We'll also talk about influenza and other respiratory viruses because the triple-demic is real. We have some updates on that. And then we'll share some other general public health announcements of some other things going on in the city, which I think that folks may have many questions for. We hope to leave ample time at the end of the meeting for folks if they have questions, but feel free to enter the chat. We'll try to answer in real time, but definitely have some Q&A at the end. All right, so on to COVID-19. So if you look on the screen, you can kind of see these are the historical trends of the last 3 years. Starting from the far left, you can see where the cases, just the number of cases in New York City at the time, and then you can kind of see over time where we've been. These big bumps or lumps or increases in the curve. These represent some of the major historical moments and major outbreaks of the arrivals of new variants. This was from when the first Omicron variant hit us around this time last year. I think a lot of folks may remember how difficult and trying those times were when even home testing was not widely available. And kind of see how far we've come now. I think a lot of folks are home testing experts on the line, but we've come a mighty long way. So we always want to show this historical reference to kind of ground us in how far we've come and what we've been through. But then to kind of zoom into the last few weeks, just looking at current community levels. One thing I do want to name is that when we look at these transmission and some of these other data, knowing that this only represents the lab confirmed testing. So these are the folks who've gotten those PCR tests. We don't have a mechanism to collect home testing data, but these data are still really important, these lab testing data, because it really just shows us what is going on, and we're able to and it always kind of aligns with what's going on in other parts of the country. And so this data is still important. So what you can see across each of these lines, each of these squiggly lines represents cases across the 5 boroughs, and you can see across the 5 boroughs in general, you can kind of see where the current citywide transmission is. You can see that we had increased transmission around the end of November through December. We're seeing a little bit of a downturn in cases. We want to keep an eye on this, and I'll mention that why, because we are seeing with the new variant. What we do also want to look at is hospitalizations by age. Hospitalization is an indicator that we've kept an eye on in terms of how severe this thing is, but also who is actually being impacted when we see cases go up. So what we see is an unfortunate pattern with COVID-19 infections, that when we look at the folks who are most likely to be hospitalized and unfortunately pass away from COVID-19 infections, it's our most folks who are our seniors, particularly folks 75 and older, who are hospitalized at higher rates with COVID-19, but then also our some of our younger elders, folks 65 to 74, folks in these age ranges tend to have more severe illness. So that's why we want to keep an eye on what's going on, and that's what we do when we talk about vaccines. Really want to encourage folks in that age group to take those precautions, but then these other risk reducing behaviors, such as masking and other things to keep themselves safe. So we have seen hospitalizations, even though the overall hospitalization trends, they've been a little bit up. We kind of see winter and seasonal shifts over the last few years. So we know the hospitalizations do tend to go up in the winter, but they're following the similar pattern. That said, I mentioned this new variant, and I wanted to kind of just unpack where we are. This current dominant variant has a complicated name. Sounds like something out of Star Wars. It's called referred to as XBB.1.5. That's the name of the variant. And basically, what we're seeing now is multiple variants developing out of one particular line, out of the Omicron variant. Various other variants have come from it. So these are the descendants of the Omicron variant. And what we're seeing is that each of these subsequent variants, we'll see that one variant may have a particular, some kind of features about it that helps it survive a bit more and makes it a bit more resilient. And what we see is that this XBB.1.5 is actually the most transmissible form of COVID that we've seen yet. To put in other terms, COVID ain't what it used to be. COVID is a very different, the variants of COVID that are out right now, dominant, are very different than what we first encountered 3 years ago. And it's even very different than what we were dealing with 1 year ago when we saw the Omicron variant. The original Omicron variant. Over the last few weeks, what we've seen is that this XBB.1.5 has actually really become dominant really fast. If you look on the purple, and this data is available on the DOHMH main website. You can kind of look over time in the variants. So it goes from left to right, and you interpret this image looking like up and down at like slices in time. So if you look, and it's interactive on the website, if you kind of look the percentage of what XBB.1.5 made in the beginning of December, it was a very minimal compared to some of the other variants that were circulating, but in just 4 weeks time, this variant, or over the month of from the beginning of December to the beginning of January, this thing multiplied so quickly. So now it's about 85% of sequence cases in New York City. So highly transmissible. What we don't know, what we do know is that highly transmissible, that this thing is able to bypass a lot of the protections that we have. Antibodies that folks are able to develop are less protective. There is a protection offered, but it's less so when facing XBB.1.5 compared to some of the other ones. But what we are seeing, but we don't know much else because this is so new. This particular variant, we don't know about whether this causes more severe diseases. We're not seeing that it's affecting other age groups in ways that differ from what we've seen other variants. But we are seeing that this thing is highly transmissible, and there is some immune evasion. So protection, from prior infection, and we're seeing some of the protection from vaccination that isn't holding up as much, especially if folks are not up to date on vaccines. And we'll talk about that later. But this is what we know now. Over the next few weeks and months, we'll definitely learn more about this variant, what it really means in terms of case transmission, what it means in terms of hospitalization. I think the contextual thing is with where we are now, vaccinations, with where we are with boosting and other things, the fact that our hospitals are not super stressed, that we aren't seeing the ERs and other places really, the pressure that we saw this time last year. There's a lot of factors contributing to that, but we're keeping an eye on this thing. And we'll definitely make sure that that we update our website, but also the CDC and the World Health Organization also are really curious to understand this new variant more, which really just came onto the scene within the last few weeks. So what does it all mean? So basically, we have some evergreen guidance that we really want to talk to folks about, because this is important and this is kind of how we can stop those chains of transmission. So getting tested, it still matters. It's still important, especially if you live with, work with, or take care of folks who may be at increased risk for severe infection. So older folks, some of the youngest babies, and also folks living with underlying with some chronic medical conditions. But again, so when do I test myself? How do I do it? There's a few different things to do. If you have symptoms that are consistent with a cold, flu, COVID-19, it's better to make sure COVID's out there, rule it out. You can do a home test. If you're having symptoms, do the home test and you're like, yes or no, do I got it or not? If it's not COVID, you can talk to your medical provider and figure out which one of these respiratory viruses it is and what can we do about it. And I think that's number one. If you have symptoms, definitely want to get tested and rule it out. Don't just no hunches. Next, if we're exposed, if you know that you were around someone who was tested positive for COVID, someone who, you were with them, mask off within 6 feet, indoor space, we recommend that folks get tested 5 days after that exposure. That way you can be a bit more sure and trust the results more, knowing that if you test the next day or even 2 to 3 days, it may not have given the virus enough time to multiply and you may not be able to detect it. So it may be false negative, right? So getting tested after a known exposure or even before and after travel or attending an event where you were likely to have been exposed, that's the recommendation. There's no mandate to do this, but for folks who are concerned and really want to think about family safety and personal safety plans around COVID and other viruses, we're recommending, after, going to big events, traveling or other things, to really consider being tested before and after. Oops. All right. We also want to talk about COVID treatment because this is also part of the landscape. Treatment lowers the amount of virus in your body. It reduces symptoms and can help prevent hospitalization and some of the worst outcomes. We want to make sure that folks know that the treatment is available. Folks can get treatment delivered at home, often same day, but it is time limited. So right now with these current circulating variants, the only treatments that are the only treatment that remains effective is the oral antivirals, and you have to start that treatment within 5 days. So, from the beginning of symptoms to get that diagnosis and to start treatment, especially for folks who may have mild to moderate symptoms and may be at increased risk because of age or underlying medical conditions. It's just important if you test positive for COVID, knowing there's something that can be done, and to reach out to a healthcare professional if you have one, or you can call 311 to get connected to someone, just to be able to access all of the options. We want to make sure that folks remember and know that treatment is out there, and it can be the difference between a really bad infection with COVID and being hospitalized versus managing at home. So the bivalent boosters, they've been out for a bit, in the news and the media, they're talking, there's a lot less uptake, people aren't getting it. And I think, it's important to kind of know why we have the booster out. This bivalent booster is an update, it's an improvement on the original. It was already a marvelous thing that we had the vaccine before the end of 2020, but we needed an update. And luckily towards the end of 2022, with a lot of folks working around the clock to get these vaccines right and to be able to update it, bivalent, meaning 2 valents or 2 points, the vaccine is specific for 2 Omicron subvariants. It's wild that within the few months that this thing was cleared and approved, that the subvariants that this targets are now historical variants. We don't really see those variants represented in the data, but there is still protection because it's specific to Omicron. And so we're encouraging, the eligibility and the safety for this thing. A lot of folks in the news and media are questioning it, but overwhelmingly, these vaccines remain safe, remain effective. They're recommended for folks 5 years and older. The boosters, people 6 years and older can get Moderna, but five and older for Pfizer. If folks are curious and have any other questions, you can get more information online. Find Vaccine Finder if folks really want to get it. But we're encouraging folks to be up to date, especially as we see these vaccines that these viruses that are immune evasive, and also knowing that prior infection, natural immunity, or even an old not being up to date on vaccines and your boosters, that can actually that protection, it does wear off. And now, with lowering protection from a prior vaccine, also with these new variants that are able to surpass, you want to make sure that we're doing everything to kind of like maximize our protection, or optimize, if you want to use a business term. So there's some new data that came out from the FDA and the CDC, just looking at some of the safety signals and looking at some of what they found in terms of the efficacy. We can share a link to this data if folks want to read for themselves, but there's some data that has shown that the updated vaccine does reduce hospitalization nearly threefold compared to folks who were previously vaccinated. So folks who aren't up to date in 2023, up to date on their vaccine, we saw that there is a threefold reduction in risk from hospitalization. That's great, because we all know medical bills are wild. A lot of folks, it's difficult to kind of be removed from the workplace, removed from home, and have to deal with being hospitalized and go through that trauma. The data also showed that the updated vaccine reduces risk by a nearly 19-fold risk compared to those who are unvaccinated. So getting boosted, if you do, unfortunately, we're not able to, outpace some of these variants, but these boosters are still a reliable intervention to help reduce some of the most severe outcomes. And thankfully, a 19-fold reduction in the risk of death from being boosted. That's really major. So that's it just shows something that can really do to increase your chances of survival if you do get COVID. And then finally, there's some preliminary data that came from Israel that demonstrated more than 80% protection against severe disease with the bivalent vaccine for those who haven't gotten it. So again, it's just like severe disease that may not lead to hospitalization, but severe symptoms, feeling really bad. The boosters, the bivalent boosters have been very effective. That said, we don't have a lot of head-to-head data how the bivalent boosters are working or matching against XBB.1.5. But we have. And it may be a little bit reduced, but this is encouraging to kind of see with circulating other Omicron variants how well it has worked. So the thought is, and we've seen before, and with some confidence say that it's the effectiveness of this booster does remain, or the booster retains its this level of higher levels of effectiveness compared to not being vaccinated or not being up to date. So it's definitely still encouraged, and we'll definitely in the coming weeks to months get more maybe some head-to-head data of how the booster is holding up against XBB.1.5. Okay, so in almost done talking about vaccines, the COVID vaccines, but this is the general recommendations. Everyone 6 months and older should really consider it. This thing is out there, and as we see, a lot of the other protections, we don't have mask mandates, a lot of other kind of protections to reduce the risk of COVID-19 infections going down. We want to really encourage folks to do whatever they can, and so encouraging folks to get vaccines, especially school-age kids, so folks don't miss school. We want to have our kids, keep socially engaged, kind of keep up with their lessons, meet their markers. And then also especially the folks who are the most vulnerable, folks who are older, folks who are living with underlying conditions. Really want folks to really consider making sure that they get up to date, get updated, so they can do everything that they can to keep themselves out of the hospital, or keep themselves out of from developing severe illness. Again, get the data from trusted sources. These things are overwhelmingly safe, effective, life-saving. We've seen how this thing have we been able to, even with something even more transmissible than the original Omicron variant, we aren't seeing the lines outside of the city, the urgent cares, and the outside of every place. We're not seeing the libraries being overrun with folks. We see testing kits on the shelves still, so we're not seeing the level of transmission that we have seen. So, and the vaccines are a major contributor to that fact, and keeping the hospitals from collapsing. Okay, so these are the main takeaways when we're talking about COVID. It's not all vaccine, and for folks who come to the space a lot, we don't just talk about vaccines. We want to really look at this holistic, coming from a primary care vantage point. Prevention and not just medication. So, staying home if you're sick or test positive to break those chains of infections, wearing that face mask, especially in crowded places, especially if you're going to be, within 6 feet of another person for an extended time on the bus or whatever, on the train, getting tested regularly and figuring out what your testing schedule would look like and knowing what would trigger you to get a test. Getting up to date on vaccines, as I've said, hand hygiene, it's major. Don't gotta remind y'all, but gotta say it. And then getting treated. Treatment is available. The pills are available. And in New York City, there's many things that folks can do to get access to the pills. We just want to make sure that there is an awareness and make sure that folks tap into that to the resources that are available to them in New York City. Okay, so we're going to transition to talk about flu and some of the other respiratory viruses. Won't take too long on this. Just did want to just show where we are in terms of the flu in New York City. This visualization shows flu seasons. So the laboratory results over the past few flu seasons. 2022-2023 season, which we are currently in now, is in red. And if you look at the graph, it's the farther up shows higher numbers. So you can see we had an extremely high peak extremely early compared to all of the past few flu seasons. And so luckily or thankfully, we've definitely the peak, we've passed that peak. The curve has been flattened, and we see that right now the transmission or the number of positive tests for influenza are definitely coming down. But I do want to note we have seen later in the season upticks, so what we call biphasic, or we've seen we've had a peak and then had later peaks. So we're gonna just be mindful of that. Flu is unpredictable sometimes, and so just want to name and acknowledge that flu is out there, and that it can be unpredictable and can throw us curveballs. It already threw us one this season. Hopefully we can get ourselves ready and be prepared so we don't get another. And one of the things that we can do is just really to think about influenza vaccines. The reality is we all got to be protected, and a lot of us who have gotten the flu before, maybe young, healthy, not no known medical issues, but we all have, we live in communities. We have a lot of folks who we interact with, and just really what can we do to protect everyone, and just really being mindful of similar risk groups have risk for bad infections with flu as with COVID. So folks who are pregnant and expecting, children younger than 2, but also adults older than 65 especially, but even around 50, we see that's kind of when flu can start to kind of hit a little bit harder on folks. And also folks with some chronic medical or health conditions, specifically chronic respiratory conditions such as asthma or COPD, other cardiovascular diseases or heart disease, or have a history of stroke, diabetes, and also chronic kidney disease. So when we think about being ready for cold flu season, these groups, influenza, and what we can do to prevent that. There's a vaccine that's out. There's also treatments available for influenza as well. So just keeping that in mind. There's some just more information. There's many different places where folks can get their flu vaccine. Folks can get them at pharmacies. Folks can get them from their doctor's office, community health centers, etc. Health and Hospitals also has flu vaccines for folks. There have been a few flu vaccine pop-ups around the city. If you want to get one that's a bit more convenient, at the health department, we actually had a few vaccine pop-ups to get folks in the agency vaccinated well. So talk to HR at your respective agencies, and see what is available, what resources are available for COVID-19 and influenza. Now we'll transition to RSV. This is another of the respiratory viruses that was part of this triple demic that we saw start to develop earlier in the season. This graphic is similar to the flu one that I showed, but this season's this season's curve is reflected in that green with the dots. And as you can see, we also had a major high and early peak of RSV this year. Again, thankfully, this trend is downward. You can see where most recently at the beginning of January, we were definitely kind of on the right side of this. But again, we've also seen later peaks and spikes with RSV as well. So just raising an awareness of that this is out there too. And RSV, respiratory syncytial virus, that's what we call RSV. That virus primarily affects children and has more severe courses in children. I mean, this year, unfortunately, we've seen more children die from RSV than other years. But the good thing is that it's come down fast, and overwhelmingly most people do not have very severe infections. We unfortunately do not have a vaccine against RSV at this time. Some are in trials. The symptoms. So what is this thing? So the symptoms are similar to a common cold. Cough, congestion, fever. Kids may kind of failure to thrive, not acting like they normally do. And as I said, most of the cases are mild. But talking to your pediatrician, if your child or a child in your life kind of has these symptoms, to really think about RSV. And really, especially, being keeping your sensors up attuned for folks who may have weakened immune systems. So the recommendations are pretty similar to COVID. Avoid close contact with sick folks, or that's the physical distance part. Hand washing, avoiding touching your face. You want to make sure these viruses, they can get through the pink parts of our body, the mucosal surfaces. Cleaning and disinfecting, and wearing a mask is also important for RSV. If a kid is able to tolerate. All right, we wanted to talk about some of the other public health announcements that are going on in the city and that we are involved in the health department. So we'll be talking, there was a recent press release last week around overdoses. One of the core functions of the health department, we report on surveillance data for health related outcomes, and every so often we release these epi-braided data briefs. So the most recent one was just looking at what's been going on around the city in terms of around overdose deaths. I think this is something that's on a lot of folks' minds. Just understanding that the recreational drug supply, what's circulating in a city is contaminated with fentanyl and other very strong opiates, or these other kind of contaminants. So what we're seeing is folks have unintended ingestion of some seriously strong stuff, and a lot of folks are dying, and a lot of folks, the numbers are higher this year than they have been in a very long time. Also just wanted to name that Mayor Adams last week had delivered a statement on women's health, that it was a really important conversation to have, just kind of really name women's health as and elevate it to this kind of bigger societal problem. It's not just people who are women or women identified who should be concerned about it. This is the health of the city as well. So I thought the address was really important, and I was happy to see one of our colleagues, Dr. McNatt, on the call, who's one of our big advocates for women's health, especially around Black maternity health and birthing outcomes. So I did want to highlight the NYC drug checking program. The city is currently piloting a program with some community-based organizations in Harlem, the Lower East Side, and South Bronx to actually use a scanner to detect substances in some of the street drugs. I think it's really important to kind of have an idea of what's going on. And they've tested hundreds of samples. I think it's a good way to know what's going on, what's out in the city. Folks may also see the Narcan program to get bars and other places to have Narcan, or this is the antidote for opiate overdose. And also just really raising an awareness that this is out there. Letting folks know, revelers know this is something to be concerned about, to make sure that if they are partaking, to test, and to know that this is real, to have Narcan at home. Folks can get Narcan for free in New York City at multiple sites. Just really encouraging folks to kind of have this bigger picture. This is an issue that's a public health issue that's going on in the city. And so, yeah, just wanted to really highlight that we are definitely aware of this and really trying to look at what we can do to help for prevention and harm reduction. Right. I think in terms of women's health, just wanted to name Abortion Access Hubs. This is a first of its kind program that's happening in New York City, where folks can call in and get access to abortion care providers operating in the 5 boroughs. Multiple languages are available, and the staff members have been trained on customer service, confidentiality, sexual and reproductive justice. So folks know the issues that folks are facing. Just wanted to make sure that folks, in response to this bigger kind of problem, and knowing that folks do come to New York City looking for, acceptance, looking for a place where they can feel safe and get what they need. So, I'm really proud that this is part of our response to a public health issue. And there's more information on the screen. And so as we get ready to wrap and open up for questions, and I did good on time, very proud of that. At the final messages, right? We get through this together. No one ends a health crisis by themselves. No one gets through the pandemic by themselves. We are people. We are communal beings. So we have to do this together. Knowledge is power. We want to make sure that we are aware that the misinformation, the disinformation folks, and the folks who really just want to sow division and derision out there and divide and conquer us, they're out there. So going to trusted sources, validating and verifying. And if you don't know, better to validate and verify versus just spreading a thing or sharing a thing that kind of seems that is exciting, but has no backing. And finally, I think the other kind of thing is just really to take care of ourselves and others. The holiday season is tough, winter is tough, seasonal affective disorder is real and tough as the days they're not getting long enough yet. And then there's a lot of resources out there for us and for our communities, especially mental health resources. Just really want to just name NYC Well. We always make sure to name that, and then also just call attention to stopping the spread of the virus in New York City. And as we'll get Dr. Wong to get ready to come up again, these are the main reminders. COVID is here. And it's not necessarily, I think our focus is like, what can we do to keep ourselves safe and reduce the risk, and I think, separating ourselves, othering us, and, like some of these kind of policies, international policies or stuff that kind of stigmatize, that's not it. The only way that we really do get this is really figure out what we can do, for ourselves and our families around getting boosted. We can't box this thing in. COVID is out there, getting tested, wearing our masks, staying at home, getting treatment. That's how we get through this. And so I will pause for some water, and I will let Dr. Wong take it away.
Hi, everyone. Thanks for joining us today. I wanted to quickly mention, just to add to Dr. Watkins' presentation, there's been a lot of news surrounding sort of the bivalent vaccine, and just wanted to give a little bit more information about that. So the bivalent vaccine did have there's been a lot of misinformation, particularly about recent sort of sudden deaths of people that were quite famous. I think I'm so sorry, I'm not in football, but I think it's Hamlin, I think was his last name. And so there's just a lot of and also during the World Cup, there was also some speculation. And those really had nothing to do, there's just a lot of misinformation out there. People blaming the bivalent vaccine. That is not what's going on. So I just wanted to say that there is just a lot of misinformation out there and speculation on really things that people should not be speculating about. So just to say that. The other thing is, there's that safety signal. Again, we really did not, so it's very, the FDA investigates every single safety signal, and so they saw like a very, very slight rise in safety for the bivalent vaccine. But there's numerous other surveillance programs in other countries, as well as other programs within the United States, and that did not catch this. And so we are just looking at other places as well to confirm, but I don't really think it'll be confirmed, but because we're just very careful about vaccine safety, it's just that that they're just confirming and just watching carefully. But right now, I still don't think there's anything to be like really concerned about. But it just has made the news, so I just wanted to sort of mention that, I guess. And also it was only seen with Pfizer, so not with Moderna. So just so folks know. Sorry, someone's asking what the safety was. I'm sorry, I'm blanking for a second. Let me just look it up real quick.
As we look that up, I can take a few of the other
Yeah, go
comments.
ahead.
So let's see, there was a question around how long did the bivalent booster last? Great question. We don't really know how long that protection lingers, but we've seen it can last for months. As soon as we know, we'll let folks know. In terms of how soon you can get vaccinated after having COVID. So great question. So a lot of it right now with BB.1.5 out there, that the answer to that question changes a bit. So most likely, if you were infected in October, probably not protective against XBB.1.5 as long as it normally would have. So basically, with the new circulating variant, which has just come to dominance within the last 4 weeks, if folks aren't boosted, definitely recommend folks consider getting boosted, especially if it's been a long while, or if you haven't been infected within the last 2 months. I would say you want to get some antibody levels up one way or the other. And I think getting vaccinated is preferable than getting infected.
Yeah, I can go
Go
back to that.
Go
Yeah, so basically, they just saw a slight increase in people above 65 who got Pfizer, and where there was an increased risk of stroke. With that said, again, COVID also can cause stroke. So again, and also we are not sure yet if this is a real thing. I kind of suspect that it's not, because all the other safety methods that other surveillance methods that we're using to look at safety of vaccines has not picked this up. So I think it may be a little blip that but we're just sort of following along closely to really make sure it's not real. So that's basically what we know so far about that.
Yeah.
And again, not seen with Moderna. So if this is something you are concerned about, then get the Moderna bivalent vaccine.
Dr. Wong, there's some questions just around getting treatment. I know you've been working on treatment. Folks are like, if I test positive, am I supposed to get it? I saw someone said a 75-year-old had to fight to get it. What do you think?
Yeah, so that is a major issue. We're still really struggling with messaging. A lot of people are still very worried because it is a new medication. It works very, very well. There's been a lot of concern about drug-drug interactions, but really, you can let providers know that there is a website. There's multiple places they can look. You can Google them. They're very reliable. I think one is called the Liverpool drug interaction. It's out of the United Kingdom that I often look at. But there's actually very, very few true drug interactions. I think there's only 2 medications that really you cannot give with Paxlovid. And those are listed in, and also those drugs are not very common. So really almost anyone can take Paxlovid, but because it's a new medication, I know people are having trouble accessing it. The only place I would recommend if you are in New York City is you can call 212 COVID-19, and they will hook you up with a provider that can prescribe it, after they review, and they're very used to prescribing. So if it's something that your regular doctor or an urgent care is not comfortable with, it's just because it's new and they are not used to giving the medication. So, I feel like it does take some consideration. But at the same time, it's probably not more dangerous than azithromycin, which is Z-Pak, which we give out like water. And so, but this actually can really make a difference in terms of symptoms and how folks feel. It does make people feel better really quickly. So 212 COVID-19 is probably one of the best resources if you really cannot get it through your primary care. I also see a question about monoclonal antibodies. So I did want to talk a little bit about that. Oh, thank you. I see somebody had a good experience calling the city. So really appreciate that. Yeah, I think we've worked really hard. Shout out to Dr. Mary Foote for really working hard to get that set up, and also Dr. Catherine Austin, who really runs that phone line, as well as the folks over at Health and Hospitals. So in terms of monoclonal antibodies, yeah, so we used to have something called monoclonal antibodies. They had to be put in into a vein, placing intravenous line and putting it into the vein. It was like a one-time, usually over 30 minutes. So those are no longer available because of the new variants. So all the variants we have right now cannot be treated with monoclonal antibodies, so it is no longer an option. With that said, so the recommendation actually is to do Paxlovid. If there is for some reason someone cannot take Paxlovid, the next choice is actually something called remdesivir. I'm sorry, I don't know the trade name. It might be Valkyrie, I think. But remdesivir. And I will say that Health and Hospitals is set up to do this. Again, you can call the 212 COVID-19 line. And if they tell you that you cannot take Paxlovid, you can also see, I think it's reserved for people that are extremely high risk for a bad, severe COVID. So people who are like transplant, people who are on chemotherapy for cancer, but you can always ask if remdesivir is an option. The problem with remdesivir is I think you have to go to the clinic to get the first infusion, and then you have to go 2 more times. And so that's the tricky part about getting remdesivir, which is why a lot of people don't take it, or it's hard to take. But really, if Paxlovid is not an option, that is the second best treatment for COVID, although it is an intravenous line once a day for 3 days. The last option we have is something called molnupiravir, and that is still available. The efficacy is not as good as Paxlovid, but it does have some efficacy, and it does really target the virus. There's some nice studies showing that giving molnupiravir did decrease the virus amount in people's bodies. And so that if you can't take Paxlovid, you can't get remdesivir, then I would do molnupiravir. I hope I think that's the most complete answer I can give. But yeah, the monoclonals are basically not an option. Okay, in terms of, so questions, I'm just gonna go through all the COVID questions. How is it being reliable? So I will say we are struggling with this as well at the health department in terms of really understanding what's happening with COVID, because you're right. We rely on lab data, and really people are doing a lot more home test kits. So really we're just looking at trends. I don't think we have a great estimate of, people who are going to the lab versus people who are doing home test kits and what that means. So really we're just looking at trends. The other indicator I like to look at actually is percent positivity, which we don't really track nicely in that, graph that Dr. Watkins showed. But it is something that you can see, you can look at percent positivity in your zip code and kind of watch it go up and down. Percent positivity right now is still pretty high. I think it's in the teens, which is pretty high. Remember, we used to have, back in the day when we had more effective vaccines, I think we used to have like a much lower, less than 5% positivity. But now we're looking at percent positivities in the teens, again, which is sort of indicative of just how COVID has changed. With that said, because, even though the percent positivity is high and a lot of people are getting COVID, we're not seeing the hospitalizations we used to see, hospitalizations and deaths. So we're still trying to figure out ways. I will say, we have a slightly more reliable testing in sort of some congregate residential settings like nursing homes, and those sort of continue to be high. So again, the data is very complicated. I think in general, I would just look at trends to know whether cases are going up or down. In terms of whether or not it's similar to, we don't measure transmissibility. So there's a question about transmissibility versus the regular cold or versus the flu. We don't measure transmissibility for like the common cold. We don't really do surveillance on that. But, I just dropped something in the chat about flu versus COVID. And I think it basically says that, COVID is more transmissible than the flu, and also has so far caused more hospitalizations and deaths. Of course, this changes a little bit with different variants and different variants, and sort of, depending on how vaccinated people are, as more folks get vaccinated, particularly with the bivalent, this will probably change. but yeah, so far it seems to be more transmissible than the flu. How is the new variants produced? I think that's a very complicated question that I may not be able to answer very
sure.
well, but basically,
Yeah. You
and
wanna
it gets
go
to
for it,
like
Shelby.
really intense science, but basically the virus makes multiple copies of itself and basically can make mistakes along the way in the copies, and those copies sort of arise to new mutations, or they can kind of have like virus sex. It's not really, or they, they basically combine with each other, and that's another way that they can produce these new variants.
Think about it like
Uh,
like a micro evolution. Things can change.
Things change all the time.
Things
Yeah.
change. The more transmission that we see, so these big surges, what happens is a lot of infection happening, a lot of the virus is passing forward, that creates opportunities for these small changes to happen. And some of these changes stick. Some of these changes give it an advantage. It can bypass vaccines. It can kind of bypass this or that, be more, replicate faster. And so that's kind of how we get to this point where we are now.
Okay, I don't know anything about the name Kraken. Someone asked, is the name Kraken being accepted as the official name
No.
of XBB 1.5?
No.
I don't think so.
That's a
We have
colloquialism. It's
just
not-
called it XBB 1.5.
Yeah.
If you are infected, are you infectious prior to becoming COVID positive? We usually say, the infectious period is 2 days before symptoms start, or, sort of approximately 2 days before the time of the positive test. That's kind of a rough estimate, obviously not exact, but that's approximately what it is. It's actually different for the flu, so it differs from different viruses. I feel like what if you are out of state, Florida, for a few weeks? Any suggestions for getting help if you tested positive while you're away? I don't really have any suggestions because I don't know what's available in Florida. Obviously the same, we usually recommend isolation, if you do test positive, and then, trying in urgent care, if you feel like you need treatment. Sometimes if you call your regular doctor, sometimes I think if you can send it to CV, like a large, national pharmacy, they can sometimes fill it in another state. But that is sort of, so if you call your regular doctor and try to have them send it, that might be possible. Does someone have to take Paxlovid if they have mild symptoms? If you qualify for Paxlovid, meaning that I think if you're above the age of 65, if you have an underlying medical condition where you would really benefit from Paxlovid, we recommend that you take it right away. It has to be taken within 5 days of symptoms starting. So even if you have mild symptoms, it's actually meant for you to take when you have mild symptoms. So don't wait until your symptoms get bad. I think that's a big misconception among people, as even doctors. Like I have a neighbor who is texting me and asked, and her cardiologist was like, oh yeah, don't take it because your symptoms are mild. And I was like, no, you want to take it when your symptoms are mild. So she's a bit higher risk. And I was like, no, just take it right away. So anyway, so yes, take it when it's mild, take it as soon as you get it. If someone got COVID in 2022, how long should you wait to get the shot? I'm guessing the bivalent shot. So sorry, we just got a phone call. It depends on when you got it. You can get it right away if you want to, or if you want to, you can also wait 90 days. The risk of getting COVID again is not particularly high within that first 90 days after getting infected. So
Hasn't been. We don't necessarily know
True,
with
hasn't been.
with XBB.1.5, it's a game changer, right? Each new variant can shift us in a different direction, and the level of protection, the amount of protection can change with the variant. So the risk of, there's one outcome is infection, but the other outcome, which the vaccines still remain really good at, are preventing severe infection, preventing hospitalization and death. So the getting COVID, that's the really hard, preventing someone from testing positive, yes or no, that's the really hard one to be able to really keep high with the variants. But these other outcomes of severe infection, hospitalization and death, the vaccines are still really good at that. So you can wait up to 3 months, But because you do get some antibodies, up to 3 months, but some folks, you don't have to wait those 3 months if you'd rather just have the antibodies from your infection, and add a bit more robust with the vaccines.
So yeah, a few more questions. I will say the bivalent vaccine right now is the best protection against XBB 1.5, even though we don't really know the efficacy. Again, we have an Omicron specific vaccine, and XBB 1.5 is Omicron. So just to keep that in mind. Is there a way for someone to tell is there a way for someone to tell if the COVID they just had was XBB 1.5? The only way you can tell, you can't tell, like we can't test the COVID you had to know what variant it was. But with that said, I think if you had it very recently, depending on when you had it, you can actually look at the data page. So I will say the sequencing probably lags by a couple weeks. So if you had it recently, it probably was XBB 1.5, like 90% chance that it was XBB 1.5. So most likely.
Yeah. I think a big thing, so when we talk about the variants, and understanding the variants, routine testing is not we don't have the capability to sequence. They have to send the virus for genetic sequencing, but we have surveillance labs, the city, and then also some private places that are testing, randomly sampling to be able to understand the variants and kind of determine subgroups, because it's like a tree. And so we can't really tell that way routinely, but as Dr. Wong said, the way we see with the dominance, if someone tested positive for COVID within the last 3 weeks, more than likely it was XBB 1.5 because of how prominent it is and how it kind of blew up. Most infections in New York City, it seems to be are responsible to that.
Yeah, let me just address this question about testing. I've heard that without symptoms, at-home tests are not accurate. Yeah, so the at-home tests have never been they're fairly accurate, but they're not nothing's ever 100% accurate in terms of testing. It is more accurate if you do have symptoms. With that said, you can still use home testing, particularly for if you've been exposed and you want to test on day 5. The recommendation for at-home testing is taking 2 tests, 24 to 48 hours apart, which increases the accuracy of the home testing. Okay, is the Johnson & Johnson is still available. You can look at it on Vaccine Finder. I think someone might need to mute. But yeah, you can actually find it on Vaccine Finder. I think it's not as common, and really the mRNA vaccines, Moderna and Pfizer, are still recommended over the Johnson & Johnson vaccine. The other vaccine that is available is also Novavax, and I actually would probably recommend Novavax over Johnson & Johnson. It's not an mRNA vaccine; it's a protein-based vaccine similar to like a hepatitis B vaccine. And so, if it's the mRNA piece that's making you kind of nervous, and you want something that uses kind of older vaccine technology, Novavax actually may be the way to go rather than Johnson & Johnson. But if you want Johnson & Johnson, it's still available. You can look at Vaccine Finder to try to find where it's offering it. Should Paxlovid be taken in low-risk patients or only high risk? Right now, it's still recommended just for high risk. With that said, almost any medical condition will make you high risk, including mental health conditions, high blood pressure, diabetes, which are all very common. Asthma. So really look at the CDC list, because you may be kind of at a higher risk and not know it. I'm going to go, Paxlovid has an HIV treatment component. How can you ease apprehension concerns? Yes, it is the Ritonavir. So Paxlovid has 2 medications. One of them is something called Ritonavir, which is used in HIV medications. I guess it's really hard for me to know what concerns there are. It's just like any other medication. They're all, like Dr. Watkins said, they're really unrelated to HIV medications. Ritonavir is used not really as an HIV medication per se, The reason ritonavir is used is actually to increase the drug levels of the other medication. So that might be one way. So we have ritonavir in Paxlovid to increase the level of, I can't ever say it, starts with the N, nirtriltemavir, I think, or nirtril some, I can't ever say it. It's a very long N word. But it basically just boosts, it keeps it longer in your body. So that's the purpose. And we use it in HIV for the same reason. It's not that we're using ritonavir to treat HIV. We're really using it to increase and keep high drug levels in the body for, enough that it's actually will treat. Because if your body just gets rid of the medication right away, it doesn't really help, right? So that's the reason it's used, and that's really why it's used in these medications. Okay, I think we actually got to all the questions, and it's at time. We're pretty close to time.
There was a couple quick ones that we can take. So there was a question earlier. If someone's 50, no health conditions at all, and gets infected, has mild symptoms, do they need to take the Paxlovid? Talk to your provider. It's a choice. We know that some folks a lot of folks who get COVID-19, are asymptomatic or have very mild illness. But we also know that some folks who have no past medical, even younger than 50, get this thing and then it can go bad. So I think it's a combination of, talk to the doc, kind of see do you feel comfortable? If you see yourself getting more symptomatic with, this mild symptoms is getting worse, you have a 5-day window to kind of like, do I want to go about this route and make sure and kind of be more judicious with it, or just know that, I have to let this thing ride out the next few days? That's kind of a personal choice, but just letting folks know it's an option. It's something to really consider, like really sit with. We are still unable to get these things posted for folks to be able to visit later. Hopefully what we can do this year is to get these things to be able to post these. I think folks, we hear you, and folks, we know that folks appreciate it, and we appreciate that. What else? I think was that it. Oh, there was a question around the COVID numbers. Long conversation, but we'll say the numbers are high in this winter season, but we're not in a massive peak. But we're concerned with this new variant. We don't really know where this thing will take us over the next few weeks. So that's kind of why we're still kind of encouraging folks to take precautions, wear your mask, especially in enclosed environments. If you don't know the vaccine status of other folks, but especially if you live with, work with, or take care of folks who are at higher risk, really urging folks to really wear masks. The commissioner of health made recommendations for folks who are going to take extra precautions and wear masks. I think that we made it, and we have 2 minutes to spare. So we can get ready. We'll wrap up, give folks the rest of let folks get back to work and get ready for the weekend. Thank you so much for attending, showing up on a Friday in January when you could be doing many other things. We hope that you found this useful. We'll be sure to we'll figure out scheduling for any kind of future events. We're going to see what else we can do to kind of make sure that folks, we believe city workers deserve to hear what their colleagues in the health department are doing. We want to share this information, put it out there, because knowledge is power. So thank you so much, Dr. Wong. Again, thanks to everyone working behind the scenes to make this space happen. Thanks to all the folks who were helping with reviewing, and all of you guys for just showing up again every day, working for the city. Difficult times, rough times. The presentation is not online. Hopefully soon we'll get it. That's something we want to work on for this year. But yeah, difficult times. A lot of weird announcements and things. So just really hope that folks can get, can stay up to date and not get lost in the hype, and really, really focus on what we can do to keep ourselves and our communities safe. So yeah, thank you so much. Have a lovely rest of the day, and take care. So some folks asked some questions in the chat. you should keep an eye out for boosting. There's a booster right now, this up-to-date booster for CL by Dr. Wong. You should get boosted and then keep an eye out for when the next one comes. Seems like these boosters, hopefully maybe once a year, these boosters, but we'll see, depending on the virus really leads us. We're really responding to the virus. And then again, Edgardo, unfortunately, we're not able to distribute these because the data literally changes every day. We don't have authorization, but we hope to be able to share these, or at least post these in a way that folks can see at future times. So I think I got through everything. So have a lovely day. Have a lovely weekend. Take care of yourselves. Bye, everybody.